I am Brittany Hollins, RN, BSN, NP student. This podcast was recorded on July 15, 2018 in Blanco, Iowa. More than 115 people die every day in the United States after overdosing on opioids, according to the National Institute of Drug Abuse, 2018. Around 21 to 29% of people prescribed opioid pain medications misuse them, according to the National Drug Institute, 2018. The opioid epidemic is an issue that hits close to home for me because many people from my community, including some family members, have been victims of opioid addiction. Some people may be wondering, what are opioids? Opioids are a class of drugs used to treat pain, according to the CDC 2017. There are both prescription opioids and illegal opioids. One of the most common illegal opioids is heroin. Common prescription opioids include oxycodone, hydrocodone, morphine, and methadone, according to the CDC 2017. Fentanyl is a synthetic opioid that has recently been made illegally and distributed. Fentanyl abuse has been on the rise in many states, according to the CDC 2017. The rise of the epidemic began in the 1990s when pharmaceutical companies assured providers the patients would not become addicted, according to the CDC 2017. The first wave epidemic began when providers began to prescribe opioids more often. The second wave was 2010 when more people began to overdose on heroin. The third wave began in 2013 with illegally made fentanyl. The Midwest saw an increase of 70% in opioid overdose from 2016 to 2017, according to the CDC 2017. You may wonder how you can help fight the epidemic in your community. The United States government is working on initiatives to fight the opioid epidemic, but there's a lot we can do as citizens as well. The International City-County Management Association has explored different ideas to fight the opioid epidemic in cities and towns across the United States, 2017. We need to develop more ordinances and places for safe drug disposal. First responders need to be trained in the use of naloxone for reducing opioid-related overdose deaths. We need to advocate for using drug court to fight opioid addiction and creating a drug treatment referral program through local law enforcement agencies, according to the International City-County Management Association 2017. Support of these programs and others in your community will help to fight the opioid epidemic, making all communities a little bit safer. The opioid epidemic is a national crisis that affects public health of all citizens in the United States. Whether the opioid epidemic affects your life directly or indirectly, support local programs and state laws to fight the opioid epidemic. Starting the change in your community is just the beginning and is more than an overnight process. The change you will see in your community will be worth the time and effort. Thank you for listening.